While antibiotics are important, and have saved thousands of lives from treatable microbial infections like pneumonia, they are frequently misapplied or overused. Prescription antibiotics are also only effective against bacterial infections, implying that they are ineffective against viral infections. Herbal remedies are commonly used to not only improve lung health, but also to heal infections and even repair lung damage. 20 medicinal herbs to get rid of mucus and phlegm in your lungs. Lungwort Pulmonaria officinalis. Lungwort has a high mucilage content, which makes it useful in the treatment of upper body problems, particularly chronic respiratory disease. It works well in conjunction with other natural herbs, such as COLTSFOOT Tussilago farfara, to treat chronic coughs, including whooping cough, and may also be required to treat asthma. The flowering shoots and leaves are diaphoretic, demulcent, astringent, diuretic, emollient, mildly expectorant, and resolvent. They are commonly used for their anti-inflammatory properties in pulmonary issues, and their mucilaginous nature makes them useful in treating sore throats. Externally, the leaves can be used to stop bleeding. They are harvested in the spring and dried for future use. The plant's distilled water is an effective eyewash for tired eyes. The plant provides a holistic solution. It is used to treat bronchitis, coughing, and diarrhea. ELECAMPANE Inula helenium. ELECAMPANE is a plant native to Europe and parts of Asia. Typically, ELECAMPANE is used to remove phlegm that causes respiratory problems, as well as to eliminate digestive tract bacteria that causes stomach problems. ELECAMPANE is also used to flavor foods and beverages, as well as to scent beauty products. According to some natural medicine experts, ELECAMPANE may be used to relieve pain caused by lung diseases, such as asthma, bronchitis, and whooping cough. Because ELECAMPANE is said to prevent coughing, this natural herb may also help with tuberculosis symptoms. ELECAMPANE is said to loosen phlegm, so that it can be coughed up and eliminated from the body. According to studies, sesquiterpene lactone compounds in the herb have also been found to have an anti-inflammatory effect. This natural herb contains a high concentration of prebiotic-soluble fiber inulin, which promotes a healthy and balanced digestive system. ELECAMPANE has antimicrobial and astringent properties that may protect against microbial infection. Cautions. If you are pregnant or breastfeeding, you should avoid taking ELECAMPANE. ELECAMPANE is not ideal for treating hot, completely dry, and irritating coughs, and should be avoided by those suffering from these symptoms. Do not take ELECAMPANE if you are allergic to ragweed or other plants in the Asteraceae family, which includes chrysanthemums, marigolds, daisies, feverfew, chamomile, and echinacea. CHAPARRAL Larrea tridentata. CHAPARRAL, also known as creosote bush or greasewood, is a desert plant that is used as a traditional herbal remedy by Native Americans to treat the common cold, bone and muscle pain, and snake bites. CHAPARRAL containing commercial products have been marketed for weight loss and alleged anti-inflammatory, antioxidant, and blood-purifying properties. CHAPARRAL tea is used to treat gallbladder and kidney stones in traditional medicine. Lignans are compounds derived from plants. CHAPARRAL contains lignans. They have anti-cancer and estrogenic effects. Nordyhydrogauritic acid, NDGA, is the most abundant lignan in CHAPARRAL. It is a powerful antioxidant. This means it protects cells from damage. Despite being an antioxidant, it is dangerous. NDGA causes liver damage in high doses. M4N is an NDGA-derived chemical. It is also referred to as an NDGA byproduct. Scientists have investigated M4N in laboratory research on mouse and human cancer cells. They discovered that M4N can inhibit the growth of cancer cells. Cautions. Chaparral should not be used if you are pregnant or breastfeeding, have kidney or liver problems, are taking certain medications, are diabetic, are trying to conceive. Chaparral may protect against ovulation, lowering your chances of obtaining a pregnancy. COLTSFOOT Tussilago farfara. For thousands of years, indigenous Americans have used coltsfoot to improve their lungs. It removes mucus from the lungs and bronchial tubes. It soothes mucous membranes in the lungs, and has been shown in studies to help with bronchial asthma, coughs, respiratory disease, and a variety of other lung ailments. Coltsfoot is available as a dried tea, or as an alcohol extract known as a tincture. RIBWORT plantain. Plantago lanceolata. Plantain's mucilaginous compounds have a soothing effect on the lungs, reducing inflammation and irritation, and aiding in the removal of catarrh. Plantain is also used to treat peptic and intestinal ulcers, as well as gastritis and colitis. Plantain can be used as a mouthwash or gargle to treat inflammatory conditions of the mouth and throat, and as an ointment to treat hemorrhoids, cuts, and bruises. Cautions. Plantain should not be used if you are pregnant or breastfeeding, unless under medical supervision. OSHA root Ligusticum porteri. OSHA is a perennial herb related to carrots and parsley. It is commonly found on the outskirts of forests, in the Rocky Mountains and Mexico. Although there are 12 Ligusticum species, only Ligusticum porteri is considered a true OSHA. OSHA can reach a height of 3 feet, 1 meter, and has small bright green leaves that resemble parsley. It is also distinguished by small white flowers and wrinkled, dark brown roots. OSHA, also known as bear root, Porter's licorice root, Porter's lovage, and mountain lovage, has traditionally been used for its purported medicinal benefits in Native American, Latin American, and South American cultures. The root is used to boost the immune system and treat coughs, pneumonia, colds, bronchitis, and the flu. It is also used to treat indigestion, lung diseases, muscle aches, and sore throats. OSHA root is now most commonly used as a tea, tincture, or decongestant. Cautions. Pregnant or breastfeeding women are strongly advised not to use any form of OSHA. Elderberry. Sambucus canadensis. Elderberries are the Sambucus tree's fruit. The most common variety is Sambucus nigra. Clusters of small white or cream elderflowers and bunches of small blue or black elderberries adorn the tree. Elderberries have long been used by Native Americans and European herbalists for their alleged health benefits. Among these are immune system boosters, which help the body fight off colds, flu, and other respiratory infections. Cautions. Do not use elderberry if you are pregnant or breastfeeding. Perilla. Perilla frutescens. Perilla is frequently combined with other natural herbs for the treatment of respiratory system problems such as colds, flu, and coughs, as well as to alleviate symptoms caused by poor digestion function, such as lack of appetite, nausea, and bloating. Perilla is also effective in the treatment of hay fever and dermatitis. It is an important component of the compo herbal formula, Cibocudo, a popular treatment for a variety of allergic problems. Perilla extracts have been shown in laboratory studies to have significant anti-allergic and anti-inflammatory properties. Clinical trials have yielded promising results for the use of Perilla oral preparations for the relief of hay fever symptoms, such as watery, itching eyes. Additional studies have found that using a topical Perilla cream improves the symptoms of allergic dermatitis. Cautions. If you are pregnant or breastfeeding, do not use more than culinary amounts of Perilla. Sweet violet. Viola odorata. Sweet violet is used to treating skin conditions, such as eczema and psoriasis, as well as respiratory catarrhal conditions, where it can help remove mucus from the lungs. Sweet violet has a long history of use in traditional herbal medicine, as an adjunctive treatment for certain types of cancer, including breast and lung cancer. Recent laboratory studies have revealed the presence of specific compounds in the plant that have an inhibitory effect on tumor growth. Further research is required before this traditional use can be validated. Cautions. Consult your healthcare provider about the safe and appropriate use of sweet violet. If you are pregnant or breastfeeding, avoid taking sweet violet. White horehound. Marobium vulgare. White horehound contains expectorant properties, which help to break up thickened phlegm and encourage coughing to remove it from the respiratory tract. Herbalists recommend it for coughs that are dry, hacking, and unproductive. Cautions. White horehound should not be substituted for black horehound. Do not take white horehound if you are pregnant or breastfeeding, except on professional advice. Marshmallow Althaea officinalis. Coughs can be treated with both the roots and leaves of the marshmallow plant. Herbalists, on the other hand, prefer the root for its higher mucilage content, which is responsible for the herb's soothing effects on the respiratory mucous membranes. Cautions. Marshmallows may hinder the absorption of various other medications, so separate dosages by 2 hours. Do not take marshmallow if you are pregnant or breastfeeding. MULLEIN Verbascum thapsus. Mullein has been in existence for thousands of years. Its leaves and flowers have been used to treat a variety of ailments, including coughing and other respiratory problems. It is available in the form of tinctures, teas, pills, and elixirs. With only a few reports of side effects, it's generally thought to be risk-free. Mullein oil has traditionally been used to treat earaches and some skin diseases. Although research has been conducted on the potential benefits of mullein, the majority of the studies have been conducted in the laboratory. There haven't been nearly enough human studies to reveal the herb's healing properties. Cautions. It is not recommended to use during pregnancy or lactation. If you have a medical condition or use pharmaceutical drugs, please consult your doctor. Eucalyptus, Eucalyptus globulus. The essential oil extracted from eucalyptus leaves has powerful antibacterial and antiviral properties. Today, eucalyptus essential oil is widely used as a treatment for upper respiratory infections, primarily as a decongestant for catarrhal conditions. It is typically used as an external preparation, in the form of a chest rub, or as an inhalant by adding a few drops to a vaporizer. Internal use of the essential oil is not advised, except in commercial preparations, such as cough lozenges and coughing blends, where the oil is present in a diluted form. Cold sore treatment is one of the oil's topical applications. It is also a common ingredient in a variety of ointments, used to relieve muscle and joint pain. Cautions. If you are pregnant or breastfeeding, avoid using eucalyptus. Thyme. Thymus vulgaris. Because thyme essential oil is one of nature's most powerful antimicrobial compounds, herbalists commonly use it to treat respiratory tract infections, such as colds, flu, tonsillitis, and laryngitis. It also has antispasmodic properties, so it can be used to help with coughing. Cautions. If you are pregnant or breastfeeding, do not take thyme. Oregano. Origanum vulgare. An infusion of oregano is useful for feverish conditions, as well as coughs, colds, and flu. Traditionally, oregano is also regarded as a natural digestive herb. Because of its strong antiseptic effect, it relieves flatulence, improves digestion, and treats intestinal tract infections. The essential oil of oregano has been shown to have powerful antimicrobial and antioxidant properties, owing to the presence of the constituents thymol and carvacrol. Some commercial oregano oil products have been used to treat a variety of conditions, including respiratory and gastrointestinal infections, though substantial clinical evidence proving its effectiveness is lacking. Oregano is primarily used medicinally, in the form of essential oil, which is applied topically to relieve headaches, sore muscles, and rheumatic pain. It can also be used as an external solution to treat catarrhal lung problems, gastrointestinal colic, flatulence, and period pain. Cautions: do not use oregano in greater than culinary quantities, or the essential oils of oregano, internally or externally, if you are pregnant or breastfeeding. Licorice root. Glycyrrhiza glabra. Licorice root is one of the most scientifically researched natural medicines of our time, and studies confirm many of its traditional uses, dating back to ancient times. Licorice is used to treat coughs, bronchitis, and catarrhal lung conditions, and is a common active ingredient in many respiratory system treatments due to its soothing effects and ability to expel mucus. A substance known as glycyrrhizin is responsible for licorice's healing effects on gastrointestinal ulcers and inflammatory gastrointestinal problems. Licorice is also a tonic for the adrenal glands, so it is commonly recommended as a supportive remedy in times of stress and fatigue. Cautions: do not take licorice root if you are pregnant or breastfeeding. Chickweed. Stellaria media. Chickweed has been used in folk medicine since the 16th century, when it was commonly used to treat wounds. It was accepted as a blood cleanser over time, and it was used to treat asthma, constipation, menstrual pain, peptic ulcers, rabies, respiratory illnesses, and scurvy, among other common and uncommon conditions. Chickweed is rarely consumed by the mouth nowadays, due to its potential toxicity. That hasn't stopped some cultures from eating it, including Japan, where it's popular during the spring festival Nanakusa no Seku. Furthermore, some supporters believe that chickweed is an effective weight loss remedy. Chickweed contains high levels of bioactive compounds, such as flavonoids, phenolic acid, saponins, coumarins, and terpenoids. Alternative medicine practitioners have long claimed that these compounds are powerful enough to provide health benefits. Cautions: do not take chickweed if you are pregnant or breastfeeding. Nasturtium. Tropaeolum majus. Nasturtium is linked to horseradish, and like horseradish, contains pungent chemicals known as mustard oil glycosides, which are responsible for the majority of the therapeutic effects of nasturtium. These compounds have strong antibacterial and antifungal properties, making them particularly useful in the treatment of infectious diseases of the respiratory and urinary tracts. They can aid the body's defenses against colds, flu, and other lung infections, as well as cystitis. Caution: consult your healthcare provider about the safe and appropriate use of nasturtium. If you are pregnant or breastfeeding, avoid using nasturtium. Asian ginseng, Panax ginseng. For centuries, this herb has been used in traditional Asian medicine. Ginseng is well known for its potent antioxidant properties, which aid in the treatment of inflammation. Not only is this good for your lungs, but it is also good for almost every other organ and system in the human body. Not to mention, studies have shown that ginseng can help boost your immune system. That isn't even the reason we included ginseng on this list. The reason for this is that studies have shown that ginseng is beneficial to those suffering from chronic obstructive pulmonary disease, COPD. And, in case you didn't know, COPD is the third leading cause of death in the United States, so it affects far more people than you might think. Multiple studies have found that people with stable COPD who take ginseng have better breathing and lung function, which leads to a better overall quality of life. However, keep in mind that there is currently no cure for COPD. Traditional medicine and herbs such as ginseng, on the other hand, can provide some relief from the symptoms. Cautions: do not use ginseng if you are pregnant or breastfeeding. Echinacea, Echinacea purpurea. Several laboratory studies on various Echinacea species, and constituents isolated from the plant, have discovered a variety of immunological outcomes, which appear to validate the herbs used to sustain immunity. Echinacea is commonly used to treat infections, particularly the common cold, flu, and other upper respiratory tract infections. Some people take echinacea at the first sign of a cold, hoping that it will prevent the cold from developing. Others take echinacea after cold symptoms have begun, in the hope that it will make the symptoms less severe. Cautions: do not use echinacea if you are pregnant or breastfeeding.